Good morning again, everyone. And we've got Dr. Ryan on the line. Good morning, Dr. Ryan.
Good morning, Mark. How are you?
Well, hanging in there. Thank you very much. Let's get right to it. I know you're a busy guy and you've got a schedule today. Let's tell us about the Clear Creek County situation, cases, and then vaccinations, if you could.
Sure. So as you're probably aware, we've been without testing for the last 2 weeks or so. That has been reinstated as of today. So today we have community-wide testing available once again, and we'll continue on with the Tuesday in Idaho spring schedule from this day forward. So our numbers in Clear Creek County right now are not fact-based, given that we have not been testing for the last 2 weeks. But we continue on a downward trend in more broadly in the state in both cases and hospitalizations, which follows the trend in the country of a reduction in cases and hospitalizations, although fatalities is a lagger, and that has not yet dropped. So we have not seen a significant decrease in the number of fatalities. But case counts are going down. And as far as vaccines are concerned, we have vaccinated about 1,100 or so folks with the first dose and 200 folks with the second dose. So a good chunk of our population, about a tenth of our population, or a little more, going forward. So the challenge, as it has been for weeks, is supply. We are not getting the supply that we need or want in the county. Last week, as an example, we did not receive any new vaccines. So we were unable to give out any first-round vaccines last week. And this week, we've only received 100. So making our way through our queue as quick as we can, but at that rate, it makes for slow progress.
So there are 100, just to be clear, 100 new vaccinations to be given this week, probably tomorrow, I guess.
Correct, yep. And those folks are already queued up, already scheduled and ready to go. And so that's, it's progress, but it's not quite the progress that we would hope for.
Well, it's frustrating, and I know that we're all hoping that there will be a dramatic increase in the production and transport of vaccines. But as Dr. Fauci put it so graphically, we're not making shoes here. And making shoes is hard enough. So vaccine is a complicated process, and it'll take a while. But I'm hoping, as I know everyone is, that we'll get the supply up here in the next month or so. I don't know. You've got your ear to the ground. Do you hear anything that I might not know?
Unfortunately, Mark, I don't. I hear the same as you do. It's just maybe a day earlier. I know the federal government is hoping to get that production ramped up, and hoping in the next couple of weeks we will begin to see an increase in the number of Pfizer and Moderna. Also, as you may be aware, on the short term is the Johnson & Johnson vaccine. They probably will be applying for their emergency authorization use here in the next week or two. And then imagine vaccines will be rolling out quite shortly thereafter. So that would be yet another vaccine that we can disseminate out into the public, and it'll hopefully bump up our numbers even further, even beyond the Moderna and Pfizer ones.
I'm glad that you've introduced that subject. It was next on my list. I wanted you to explain to our listening public why it is so important, or is it even important, for people to consider the Johnson & Johnson vaccine if it is offered to them. Because I've heard a number of people who take that top line number of the percentage of efficacy with the Moderna/Pfizer as opposed to the Johnson & Johnson. And there's more to the story than that, I'm sure. Can you please explain a little bit why it may be important to consider any vaccination that's offered?
Oh, absolutely. Yeah, unfortunately, the soundbite that you hear on the news doesn't always, you need to peel the onion back, so to speak. So the numbers so far out of Johnson & Johnson, and yet we haven't seen all of the data as it is presented to the FDA here shortly. It suggests that it's 85% effective from keeping you out of the hospital or dying, which is right up there with the Pfizer and Moderna. Those are at 95%. Johnson & Johnson's at 85% or 88%. It's a lower percentage in terms of overall protection from getting COVID, but it does its job in terms of keeping you out of the hospital or dying. In addition, I know Johnson & Johnson is actively looking at what does the potential second dose do down the road, 30 days or so down the road. So they're actively looking at that. And does that bump up as a booster your overall protection into the 80 or 90% realm? So they're actively looking at that. But in my opinion, any protection is good. 66 is actually higher than what they were anticipating most vaccine makers initially when this whole process started. Right? They would be happy with anywhere from 50 to 70%. And I think we've been a little spoiled with the Moderna and Pfizer coming in at 95% or so. So 66% is still really good, and it's particularly good at doing the top end of keeping you out of the hospital and or dying, which is really the goal. In addition, for maybe potentially younger folks who are healthy, who don't have underlying health conditions, it is a very good baseline of 60 plus, 65% plus protection, keeping you from getting COVID, where your risk is low to begin with to get hospitalized and or of dying. So, and we'll see what comes out of the data here in the next couple of weeks or so, and then what subsequently comes out of the studies they're doing now, looking at does the second booster shot take that efficacy up to 90% or so.
I wanted to add something to that conversation, and tell me where I'm off base on this, but I think there's a distinction between personal protection and public health. And when we talk about public health, our goal, of course, is herd immunity and protection throughout the population. And in that regard, distributing the Johnson & Johnson even to everyone and not having any other vaccines available could eventually get us to herd immunity. So the more people that are vaccinated, the closer we come to the herd immunity number, that magic number, whatever it may be, and the better off we are as a population. Where am I wrong on that?
Mark, I'd swear you were an epidemiologist. So, no, you're correct. So, logistically, the Johnson & Johnson vaccine, you can vaccinate twice as many people in a single month than you can with any of the others, primarily because it's a single dose. And so you're getting to that quote-unquote herd immunity level much faster than you would with the two-dose regimen of Pfizer and Moderna. So you're absolutely correct. If we can get out 100 million doses of Johnson & Johnson in a 3-month period, we're a heck of a lot further down the road than we would be if we were just relying on the Pfizer and the Moderna. So, again, it's about getting a significant level of protection out there in the broader community to get to that level, that threshold of herd immunity, and making sure that as many people are vaccinated as quickly as possible. This is particularly relevant with the variants, and I'm sure you're going to ask about that, the variants that are now present in this country and spreading. We don't know yet. We don't have very good data on the level of spread. Many states are now actively looking at that through surveillance. The thing is, COVID itself, having COVID, protects and provides a level of herd immunity only to the point where that variant can't come back and reinfect you. And now we know with several of the new variants that is in fact the case. Whereas if you've had COVID, some of these new variants can come and give you COVID again. Whereas if you have a vaccine, those new variants you're still protected against those new variants with the vaccine, where you wouldn't be with prior COVID diagnoses. So it's really, really important that we get as many people vaccinated as quickly as humanly possible to help snub out the potential for those variants and the spread of those.
Yeah, those variants have gotten a lot of press, and surely they're going to be dangerous. And I guess I think of the initial a spread of the COVID-19, and I look at the exponential growth that occurred in the spring, and then again in the summer with regional outbreaks, and then of course the one that we seem to be maybe on the tail end of right now, these spikes. And it seems like there's a potential for that to occur with one of these variants as well. What do you think of that?
Oh, absolutely. Like I said, several 100 million Americans have had COVID, diagnosed or undiagnosed, in this country. And if we're starting over from that perspective in these new variants, and given what we know now that, 50% of Americans either don't wear a mask or wear it improperly, the potential is certainly there. And it's what I'm sure keeps Dr. Fauci up at night, is these new variants getting out of control. We saw it in spades in England, right? In a short period of several weeks, their numbers went absolutely straight up. And so the potential is still there for that to happen in this country, particularly given the number of cases we've already had. I mean, right? We've had more cases in this country than any other country on planet Earth. There's a really good reason why that is, and that reason hasn't been fixed yet. So the potential for the variants to take off similarly to what we experienced here in November and December is certainly within the realm of possibility, and what keeps up most people who are, experts in this field up at night.
I've been trying to sort this thing out in my mind, and I'll try to be as clear as I can, but it seems like there's this tension between this positive force that's at work for us and the things that are holding us back. And I think of the problems that we're facing. Let's start with the positive news. We have the vaccine, the two vaccines that are out there now, and this great news about the Johnson & Johnson, which seems imminent in its distribution. And so we see the reduced cases right now. Eventually, not too much longer, we'll start to see warmer weather. All of those things seem to be working in our favor. But the tension against that is, of course, these variants. And then, as the good news gets better, I expect that we'll see a reduction in the mediation efforts in the community. In other words, mask wearing and social distancing and gatherings and all that. And then just the general increase in the weariness of the COVID response. And so there's this tension, and I guess we're balancing the community is balancing those tensions right now. I don't know what to say other than, the cases are going down now, and let's hope that they continue to do so.
Absolutely, and that tension is felt on every level, from within the municipalities within our county and the state, within the country. So it's a race. It's always been a race against time. And the public health experts know that and are well aware of that. The race is to get as many people vaccinated as quickly as possible. And this has created, as you know, a lot of frustration on the part of public health and states in the former federal response or lack thereof. And so that tension remains and is going to be further exacerbated by any potential increase or flare in a variant. So it's a race against time to get as many people vaccinated as possible. And so I wish I had 1,000 vaccines a week. We could easily distribute those on a weekly basis and get as many people vaccinated as possible. But unfortunately, we're at 100 every other week. So the tension is certainly there.
Let's talk about that, the testing a little bit more. I'm so glad to hear that we have that testing capacity again and that the testing facility is open and running again. Explain to people one more time why testing is so important in the process, even now with the vaccine. Why is it important to continue testing?
Great question, Mark. It's very important for several reasons. The first and foremost is it helps us identify not only the symptomatic folks, but the asymptomatic folks who are out there, and those are the ones who are of most concern, right? People who don't feel well, tend to, hopefully more often than not go to work and discontinue any sort of external exposure to others. The folks who are asymptomatic don't even know they have COVID. And so those folks are the ones we really want to identify as quickly as humanly possible, and then do case contact tracing with those folks. We're one of the counties, only a handful now, who are actually doing contact tracing in 100% of cases. Many counties, Jefferson and other large counties, maybe 10%, maybe 20% of the cases are actually contact tracing. So in a county like ours, it helps us identify cases quickly and control that spread in isolating those folks and quarantining those folks who have been exposed. So the testing, community-wide testing, allows us to identify those folks more readily than we would without testing. Without testing, the asymptomatic folks typically don't go get tested, particularly if they have to go to a different county. So having that community resource right in the center of our county, it's free of charge. Sign up before you go and or sign up when you get there. It's literally a 5-minute process, and it lets us know of the cases that are out there, and it lets us other folks know that they're in fact not positive, and they can continue doing safely what they were doing before. So it's a critical piece of the epidemiology and the public health apparatus that we're very happy to have back online. This is a different testing company than the previous one. The previous one, there was some challenges and FDA issues around the sensitivity of it, which is why it went away. But we have an interim for this week and next week company, and then we'll have a more permanent one following that. But the process is basically the same. You sign up, you show up, you get tested, and then you'll learn of your results directly through the company.
So, in other words, everyone who has not been vaccinated, fully vaccinated, should be considering signing up for this PCR test, because they could inadvertently be infected or unknowingly be infected and inadvertently spread that infection to people in the community, either their workmates or loved ones or both.
Absolutely. I mean, we've tested over 4,000 people so far to date, which is almost half of our entire population of our county. And it's really helped us keep our numbers down. You look at us compared to all the counties around us, and our numbers have been a fraction of what the counties around us have been. So it's a critical piece, and as we know, roughly 50% of individuals with COVID are asymptomatic, meaning they don't have a fever or loss of smell or taste or anything else. So it's very critical for us to identify those folks early before they start spreading the virus to others, including those in their homes. So very, very important. And please, if you have any inclination, please go get tested. It's free of charge every Tuesday in Idaho Springs. There's more information available on our website and our Facebook page about how to go about doing that. It's a pretty easy process, and it's going to be around for the next several months at least.
Well, I would say the numbers don't lie. When you look on the CDC website or the state or website, you can see for yourselves that what Dr. Ryan says is completely true, that our caseload is much lower than surrounding counties. And the only thing we're doing differently is we are testing more, and that contact tracing, which is associated with the testing. So it works, and I've been through the testing regime. It's easy and quick. And please go ahead and do it. Now, Dr. Ryan, I did want to focus on one other element of the testing, and this is a little bit deeper into the weeds, I'm sorry. But I know that there are rapid tests available. The FDA is kind of reluctant to put those out into the community on a massive scale because they are not as accurate. But it seems to me that that if we all had 100 test strips at home that you just stuck in your mouth and told you yes or no, whether they were 100% or even 60% accurate, wouldn't really matter if you were doing it on a massive scale where you could correlate the accuracy to that large number and really focus on certain areas where there's a high incident of COVID, and that would be productive, wouldn't it?
Somewhat productive, but one of the tests in particular that the state and the federal government has been pushing for a couple months now is the Binax. The challenge with it is it's only 40% accurate, which is quite low. So it also requires folks test in a serial fashion, meaning I'm going to test myself every Monday, Wednesday, Friday of every single week, and I'm not going to miss a day or a week. And it eventually will catch me, given its low percent positivity. It eventually will catch me, but it may take a while. And so, in theory, that works. If you have a team that you're having them test in observation, meaning you're watching them test themselves every 3 days or every 2 days, every single week, it sort of would work in that scenario. But giving every Coloradan 50 tests to do at home, and the probability of them actually doing it every 3 days or every 2 days or whatever the regimen is every single week, the probability of that happening drops off quite quickly. So if it was a 90% effective or 90% accurate, I would say absolutely. But at 40%, I would much rather have a 90% accurate community-wide testing where folks can come for free once a week than test hundreds of people 3 times a week with only a 40% accuracy.
Well, that makes sense. Okay, I wanted to, I know we don't have much more time, but I wanted to ask you about another element of the COVID pandemic that has hit all over the country, and we've touched on this briefly in the past, but I know there are mental health implications for all communities, and I wonder if you can speak to the impacts of COVID on mental health response here in our community.
So great question, Mark, and you're spot on. As you might imagine, in a scenario like we've been in for the last 12 months where folks are isolated, they've lost their jobs, in some cases they've lost their homes, or they've had to move because they lost their jobs. All of those are life-changing events that have a significant impact on people. And so it's really important, and unfortunately over the last 10 months or so, those sorts of services have been limited in availability primarily because of the pandemic and the challenges of face-to-face meetings and face-to-face counseling, et cetera. But the problems have not gone away. They've only been exacerbated by this pandemic. So Clear Creek County had put out a survey last month, I believe it was, looking at that very issue. What are the services that are needed? What is the relative prevalence out there of depression, of a variety of mental health challenges? And the notion is, once we understand the magnitude of the problem and what the problem is, how do we begin to address it? And we're in that process now. I know the folks who did the survey are going to be presenting to the Board of County Commissioners here in the next coming weeks. I don't know the exact date, but they're going to be presenting their findings, and so it will begin that conversation of what resources are further needed and what resources can we get out as quickly as possible. So I know JCMH, Jefferson County Mental Health, has been a partner with Clear Creek County and continues to be. They do have services that they're now doing via Zoom, and they do have some in-person services that are out of their Evergreen office in Evergreen. So that's a conversation that is ongoing and will continue until we can get the resources needed for the broader community.
Well, as a public health administrator, I know you're working on solutions, but I wonder if you have some recommendations for people who are at home and maybe they're isolated, maybe they've lost their job, maybe they've had problems in their interpersonal relationships. Are there some strategies that you could recommend for self-help that even though they might be limited, that they could help to ease the burden somewhat?
Well, my first advice would be to reach out to the county to find out what resources are out there. Going at it alone in situations like that sometimes isn't necessarily the best way to proceed. Understanding what resources are out there and those that can help, either finding a new job or finding housing or just having someone to talk to is a critical piece of this. And so I would reach out to the county and our website to find any sort of resources that we have available for any of those scenarios. The other thing I would do is, on days like this, get out. You can still go and talk to your neighbors. Just don't go in their home and hang out with them without masks. Get out and get exercise and do those sorts of things can also help from a mental health perspective. It's not a panacea. It's not the single solution to your problems, and I'm not suggesting it is. What I'm suggesting is that finding the resources that can help you in doing little things can have a little impact, and you add those up, and it can make a difference. So find out what resources are out there relative to your specific need, and we can hopefully get you hooked up with those resources.
I couldn't agree with you more. Interacting in a safe manner with your neighbors is so helpful. I had someone drive up to Empire, where I live, to hike the trails, and a friend of mine, and she called me, and I met her out in my yard, and it set me up all day just to talk to someone who I hadn't spoken with face-to-face in almost a year. And I think encouraging that kind of behavior, that safe interaction, is exactly what a lot of people need. Dr. Ryan, I know that you're almost you've got an appointment at 11 o'clock with the county commissioners here, so I wanted to give you a chance to give us your recommendations. Here we are. We've got the vaccine. We're not satisfied with the production and distribution of that yet. We've got the variants coming. What are your recommendations for us going forward?
My recommendations are similar to what they've been for the last many months. The first and foremost is get out, get some sun on your face, interact with other human beings, as you suggested. It will go a very long way from a mental and physical health. The second is be patient. We're vaccinating folks as quickly as we possibly can. As soon as we get vaccines, we'll get you vaccinated. We will vaccinate any and every Clear Creek resident who wants it as soon as we possibly can. I'm not a magician. I can't turn water into wine or water into vaccines. So we're going to vaccinate you as quick as we can. And further, be diligent. Continue to wear your mask. Continue to social distance. It's particularly important now, even though our numbers are going down in all the right places. It's the variant that is very concerning in terms of, even if you've had COVID in the past, this variant can give you COVID again. The vaccine does provide protection against it, but it's still critical that you wear your mask and socially distance. Until we can drive this virus down into the ground and eradicate it from our society, we're going to need to continue to do those sorts of things, of wearing your mask and social distance. It's the single most effective way to reduce transmission, and I would ask that everyone continue on that path. It's the only way back to normalcy, and the only way to get through this pandemic.
Dr. Ryan, thank you for all the great information and for your guidance through this terrible pandemic. We appreciate your coming on the air and sharing your valuable time with us. Look forward to speaking with you again in the future.
Thanks, Mark. Have a great day and be safe as well.
Okay, goodbye.